which is partially true, but I quickly learned that as a transplant patient, you will never have a completely normal life. Now my life is filled with immunosuppressive medications, regular blood draws, and constant, since I'm only 3 years out now, I've had a lot of little rejection episodes and had to go in for biopsies and things like that. So while my life now is so much better than it was pre-transplant, I will forever be dependent on either dialysis or another person's kidney to survive, all because of a disease that can be stopped by one simple vaccine. So I just wanted to take this time to thank each and every one of you for the work that you do in the community, because this is something that a lot of people don't realize how real it is. And most of all, people don't realize this is something that doesn't go away when the disease is gone. If you're lucky enough to survive from bacterial meningitis, it's something that will haunt you for the rest of your life. So for the rest of my life, I will have some sort of health problem to battle. I will have some sort of obstacle to overcome, and I will never be able to live a normal life. And for me, I've found a way to adapt to that. I've found a way to take my story and make a difference with it. But just because of that doesn't mean that it's right that anybody else should. And I know that you all share the same passion as I do for vaccines and for disease control and for immunization awareness. So thank you again for all of the time and effort that you put into this. Personally, it means a lot, because there is no excuse that anyone should have to live this lifestyle because of something that can be prevented by one simple shot. Nobody. One of my favorite quotes is from Mahatma Gandhi: "Be the change you wish to see in the world." And that is exactly what each and every one of you are doing by being here and by pursuing the occupations that you have. So thank you again, and thank you for listening.
We'd like to introduce our next panelist, who was Leslie's doctor during his residency in Texas. Treating Leslie as a young, impressionable resident has made a lasting mark on local pediatrician, Dr. Dan Friedman. Welcome, Dr. Dan.
Thank you. So my name is Dan Friedman, and I'm a general pediatrician here in the Seattle area. I work just south of Seattle in Renton, mostly at Valley Medical Center. And when I was in my second year of pediatrics residency in Houston, I took over Leslie's care a couple of weeks into her hospitalization. One of my friends named Tarsi Dondlinger was the admitting resident who took care of her in the first couple of weeks, and then I took over. And pretty much the whole time I took care of her, she was in a coma. And the story as I knew it was pretty much what Leslie told us about. She was life-flighted into the hospital, and she was awake and sitting up in bed initially, and then within minutes, I mean, she was in a coma, multi-system organ failure, disseminated intravascular coagulation, just as sick as anybody can possibly be. And so the part that really stuck with me at the point when I was taking care of her was not the degree of the catastrophe, because that had sort of subsided by the time I took over, but the part about, well, someday I'm going to be a doctor working in an office in the community. How do I know when I see somebody sick like this to make the right call? I mean, you know, you heard her story. Initially, she didn't look have whatever look she needed, you know, or that triggered alarms in her doctor's office earlier that day. But we know this disease is scary fast in what it can do to people, and so how do we be sure, and how could I teach myself at this moment to make the right call at the right time? Because at that moment, you got to call Life Flight. You call EMS. You call the National Guard. You call the United Nations. You call whomever. You just set off alarms, and you make things happen. And that's what had to happen for her. And thank goodness her parents recognized what was happening and sort of said the magic words on the phone that then made somebody say, "Oh my gosh, get down here right now." I took care of her for about a month, and she was in a coma for almost the entire time, and so I really never got to know Leslie. But I thought a lot about you and about the lessons that I learned from you, because this was such a dramatic story, and for whatever reason, it stuck with me and it impacted me in this sort of a way that just I knew that I had to sort of hit this mark of knowing what I needed to know. And during all of our training, we all have moments when these kinds of things happen to us, where we have a moment where we say to ourselves, I need to be sure that my knowledge level is up to where it has to be. When that moment, if it ever comes, that I know what I need to know and I'm prepared. If you fast forward about 10 years, I'm in my office, it's lunchtime, and I'm just flipping through a book about vaccine-preventable illness, and I flip it open and I think, hey, it's from Texas Children's Hospital. This is where I did my training program. And there was a lot of talk going on in my office at this point with parents about vaccines, and for the first time in significant numbers, patients were taking a lot of my time every day telling me, I just don't think I want to vaccinate my children. And like our first speaker tonight, my first response was, what? And I knew where it was coming from. And so I tried to answer their questions as best I could, but there was all this sort of impassioned storytelling in the news at the time that was all anecdotal, and none of it was really, the medical community wasn't really answering back at this point. And so I thought to at the time I remember thinking, I wish the medical community would answer back in a way that was heartfelt and serious, but at the same time, like, not with a sledgehammer and not kind of like overly analytical, numerical, technical. But it's important that somebody like answer in a seriously heartfelt way, in a way that would explain the miracle and the value and the benefit of vaccines in a way that would just make this argument disappear, because we all know the data is on our side. So I'm looking at this book, and I'm flipping through it, and I think, hey, somebody had bacterial meningitis, and I look at this. There's all these black and white photos. They're really haunting photos, and I look at this young woman, and my jaw hit the floor. I nearly fell out of my chair, and I'm like, that's her. It's you. It was you. It was her. And at this point, I'm just like flipping out. Like, oh my gosh, it's her. And suddenly, like in my head, I'm back in the second year of my residency. And that's not where I want to be on the learning curve when I've been in my office for a number of years. Like, now I'm suddenly back down here, and I want to be up here. And all of these memories came back, and it's like, I suddenly realized that I owed her. I owe you something. I owed this to her. I started thinking that, well, how can I, 10 years later, do something in a completely other part of the country to help her, to pay her back? I started thinking, well, we have a vaccine now that we didn't have then. And so that at least I had going for me. Like, I could at least vaccinate people and prevent the disease that she had. And and so as a result of that, I realized that, you know, I push a little harder than other people do. I inquire a little more, and you know, my tone is not like a sledgehammer, but it's almost like flabbergasted when people say they don't want to vaccinate their kid. And that's the entry point, is I'm not going to be punitive, I'm not going to be overly pejorative, but I'm going to, my response is almost like, this is the most obvious thing in the world, why would you not? And then we can enter into a conversation. And I think that's kind of one of the important things here, is that tone matters. But then I also decided I needed to do more than just working in my office. I needed to be a voice in the community. And so I wanted to be an advocate, and I wanted to be an advocate for her, even though she had no idea that I was going to be doing this. Because the thing is, like, everybody can agree, nobody needs to have this disease. Nobody would want anybody to have this disease. And in fact, really, for that matter, nobody wants anybody to have a preventable bad, you know, disease. And so we can prevent things. The hard part is that the people who got prevented don't know that like, hi, I got my shot and today it saved my life, right? It doesn't work like that. So by telling Leslie's story, hopefully I can touch people in a way that makes them feel some of the passion that I feel about it. But then the other thing I did was I called up a couple of people that I were friends of mine and were working on vaccines, especially on meningitis, and I called up and I was like, I don't care who you got to introduce me to, you got to put me in, you know, introduce me to whoever, who do I have to talk to make this happen, so that I can actually have the opportunity to stand in front of people like now and tell people that how much this matters, and then remind people of the flip side of what happens when we don't get it done, or the scary things that can happen when people aren't protected. And so I'm really appreciative of the opportunity to have this chance to talk in the community, and I'm especially appreciative of the efforts of Cindy and Tammy for putting this together, and the Meningitis Angels Foundation for bringing Leslie out here, and for giving me, I'm here to talk about me. I'm good at talking about me. The honor and the pleasure of getting to see Leslie again, and the chance to sort of share my part of her story, and to you know, share with you my passion about vaccine preventable illness.
I'm doing this in honor of my daughter, and I'm hoping that even if it saves one life, it's worth it. She died on July 4th, 2009 at the age of 35. She taught 4th grade at University Place Primary. I always knew she'd be a wonderful teacher, but I didn't know how wonderful until she passed away, and all of the colleagues that she had, and even the superintendent called me and told me how wonderful she was with kids. After she had finished teaching her year of school, she was teaching summer school, and at Multicare we were in the throes of getting all geared up for H1N1 and the vaccine coming. It wasn't there yet, and we didn't know when it was coming. And she had come to my house. We were having a late Father's Day party for my brother and for my son-in-law, and all of a sudden she just became very sick, and it just hit her like within minutes. And she was having a great time and laughing, and then all of a sudden she was getting on my bed with a pillow and a blanket, and it was probably about 85 in my house. So she felt so sick so fast that she couldn't even drive herself home. She was coming back to my house that following Wednesday because she was going to have, or Tuesday night, because she was going to have carpal tunnel surgery on her right hand. And she taught school Monday and Tuesday, came to my house Tuesday night. We went for her surgery on Wednesday. And when we got there, she wasn't feeling real well, but she never said that she was feeling very sick. And they took her temperature and her pulse ox and everything. And when they did, her pulse ox was in the upper 80s. She had a temperature. I can't remember now what it was, but she still wanted to go through with the surgery. Of course, the anesthesiologist and the RN listened to her lungs. They were completely clear, no fluid at all. but they weren't really in favor of the surgery. The surgeon came in, said he didn't want to, and she said that she'd waited for so long to have it because she wanted to do it after school was out, that she was going to have it then or not at all. So they went ahead and did it. And they didn't put her under, they just did a local, and she actually felt great after the surgery, did really well at home. And then Thursday, she did well when she got up, and she had a pretty good day, but in the evening, she spiked a fever. And they told us if she spiked a fever that we needed to take her to the emergency room. And I had to go to work just for a few hours and do time cards, and when I came back, my other daughter had stayed with her, and she told me about the fever, and so I said, Hillary, we need to go to the ER. And she argued and said she wasn't going to go, and what do you tell a 35-year-old woman? But anyway, I told her, I said, well, we'll take your temperature again. If you still have a fever, you're going. And if you don't have to go. It was gone. And I even took her twice. In the morning, she woke up on Friday and felt absolutely wonderful. She told me how great she felt, and she had a good day, but she did sleep quite a bit, but that wasn't unusual after teaching for 9 months. She oftentimes would sleep a long time. So then that evening, I went in to wake her up and check on her, and her lips were blue. It was about 8 o'clock. So I knew she wasn't getting enough air, and I made her sit up and try and take some deep breaths, and she tried to and couldn't, and she wasn't, it wasn't changing her lips at all. And so we went out in the living room, and I noticed she was a little unsteady, and so we went ahead and talked about going to the emergency room, and she didn't want to go. And my brother happened to call, and he had company for dinner. I could hear him in the background, but when I told him what was going on, he said, we'll be right over. So he and his wife came over and helped me take her to the ER, and then things happened so fast. They did an x-ray, and of course her lungs were completely full of fluid. And then they decided to take a CAT scan. Her O2 sats were in the 30s and 40s, and she was still even arguing when they said they were going to put her in the hospital. She said, no, I'm going home. And she stayed so clear, and that was one thing that was kind of amazing to me. But they took her down to do the CAT scan, and she wasn't able to breathe after they sat her back up, and probably because the fluid went up. I talked to the respiratory therapist about it, and they took her to ICU immediately, and then they went ahead and intubated her, and she arrested twice, and it just went from bad to worse. She was always the life of the party when we had family get-togethers, and it's left such a big hole, I can't even tell you. And we have a small family, so it's more noticeable, I think, than if you have a large family. It would be not easier because you still have that void there. But it's made it very difficult for my daughter. They were best friends, and it's just been a really hard time. When the medical examiner called me a week later after she died, he said that her lungs were so full of fluid that they were solid instead of like sponges. And of course, she tested positive for H1N1. And it was just amazing to me to think that on Wednesday her lungs were completely clear, and by Friday they were completely full. And for her to not ever struggle for breath or even to say she couldn't breathe, I don't know why that was, and I'll always wonder why it seemed that way, but it just was an unbelievable situation, and I still can't believe that it happened. Thank you for listening to me.
I wanted to share with you a quick personal experience with rotavirus. My older daughter had rotavirus infection before the vaccination, and we had to take her to Mary Bridge Emergency Room where I work, the hospital where I work, and she had to have IV fluids on both Saturday and Sunday, so it was a traumatic experience for her, for us. And then later on, we made sure our son has a vaccination, so never had to go through that. If you look at 2007 and 2008, approximately 124, 25 patients got admitted every year with rotavirus infection to Mary Bridge. But for the last 3 years, 2009, 2010, 2011, these admissions were down to around 2024. I don't have further information to tell you if these admission even patients have actually received the vaccination or not, but the impact is actually at the state of Washington is the same. You can see that most of the impact occurs in a younger age. So it did make a big difference in the community. So thank you again for really making a big difference. And that's pretty much what I really wanted to talk to you about. I wanted to encourage you. I'm a pediatric gastroenterologist, so we don't provide immunization at our office because we do not practice primary care. But I do encourage you all to really